If you suffer from chronic or acute pain, it's now possible to have your pain evaluated and treated in the very same day. Dr. Carl's Regenerative Medicine Center in Towson is offering patients alternative treatment to relieve pain. There, they believe doctors should be treating the whole person and not just the pain. Here to tell us more is Dr. Ken Carl, Medical Director of the center. Dr. Carl, welcome.
Thank you. It's great to be here.
Happy to have you here. So for people not familiar with it, what exactly is regenerative medicine?
So regenerative medicine is the process of repairing, regenerating, and replacing diseased tissue to restore normal function.
So who would be a candidate for this? We talk about chronic pain, but what do you treat exactly?
So patients who have arthritis of the knees, hips, shoulders, either from normal wear and tear, which we call osteoarthritis, or from an autoimmune disease such as rheumatoid arthritis, excellent candidates to repair those joints. Patients like diabetics have a condition called diabetic neuropathy, where their feet are numb and they have some burning sensations. That's caused by reduced blood flow to the feet as a result of diabetes.
And you can help them with all of that.
That's correct.
That's amazing. So talk about some of the actual treatments and the techniques that you use in order to help them reclaim their lives in a lot of respects.
So the goal of regenerative medicine is to replace diseased tissue and help the body basically heal itself. So, for example, we have superpulsed lasers. This is a way of getting energy into the patient's cells, damaged cells in the tendons, ligaments, and the joints. From there, the cells can finally heal that particular injury. Once it's healed, they can have normal function is restored, and then the pain goes away.
And people will come there, and maybe they don't know exactly what's wrong, but they just know something is wrong. They'll come to you for a diagnosis, and during that time, you can also treat them, maybe?
Right. So I respect patients' time. I understand that you know, they have to arrange to get a ride to the office and so forth. So my goal is to be able to evaluate patients, and then if they want, we can get them treated that very same day.
That's amazing. And what do your customers, or I shouldn't say customers, your clients, your patients, what do they say about being able to get a diagnosis and a treatment in one day like that?
Well, they're very thankful. You know, I give them enough time so we can go over exactly what is wrong. I can make the proper diagnosis. We can sit down and discuss how regenerative medicine can change their lives by restoring normal function. So that's how we can eliminate their pain, rather than traditional treatments focus on treating the symptoms.
Right.
So when I began, it was a traditional practice. Provided medications, injections, referred for surgery. But again, it was all just treating the symptom.
Right.
Now my focus is regenerative medicine, where the focus is to restore the normal function of the patient's joint, eliminate the numbness and neuropathy, for example. And once the function's restored, the pain goes away.
Yeah, just amazing. You've been doing this now for how long?
I've been practicing in Towson since 1991, so that's over 27 years.
Yes, and then when this sort of treatment came to mind, you knew that you were onto something with the regenerative medicine, because that was later in the 27 years, correct?
Definitely.
Yes.
Definitely. So, well, 12 years ago, I introduced regenerative medicine in my practice.
Yes.
It was a superpulsed laser.
Yep.
And it really, you know, seeing how that can really change the patient's function, rather than just keep treating the symptoms. We can actually change the disease process.
We've got people that definitely want to check you out. That information was just on the screen. I love that you're right here in Towson. Thank you so much for being here. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.